Hi, my name is Elizabeth Campbell. I am a physical therapist with Limitless Physical Therapy Specialist here in Cortland, New York. I am a pelvic health provider for males and females, as well as an orthopedic and sports physical therapist. This presentation is going to be a discussion on pelvic pain conditions and what the role of pelvic physical therapy is in addressing some of these different conditions. Here at Limitless, we are so focused and driven towards our mission of growing a thriving community that inspires the best possible health outcomes. And pelvic health is a huge component that has significant impact and ripple effect on our patients as well as their friends and family. And what we're seeing is the more we discuss these conditions and the treatment of these conditions, the more willing patients are to seek treatment and to get involved in addressing some of these very personal and hard symptoms that they're experiencing. Right? The reality is that 1 in 8 adults, so men and women, will experience pelvic floor dysfunction in their lifetime. And pelvic PT really has had a little question mark around it for some time. What does it consist of? What does it involve? And really, it's just another rehab that is focused and trained in addressing these symptoms of the pelvis and the pelvic organs and the pelvic muscles. And in doing so, improving their function, but also working and leaning in on improving an individual's strength and mobility and endurance and all of those foundations of wellness and health. We care a lot about our patient in front of us on this given day, but we care a lot about our patients' longevity and their wellness in 5 years, in 10 years, in 20 years. So pelvic PT is broadly encompassing all of that. When it comes down to specific pelvic conditions, especially pain conditions, we're going to kind of review a couple across this mini presentation. Upwards of 20% of people at some point in their lives will experience coccyx pain, so pain of the tailbone. And over 8 to 12% of individuals will experience vulvodynia or pain of the vulva region. And in regards to vaginismus, some studies are reporting upwards of 68% of females can experience these symptoms. And then when it comes to more nerve or neurological conditions, such as a pudendal neuralgia, this is one of the primary nerves within the pelvis. 1 in 1,000 people will experience this. And these numbers, while some of these percentages are on the lower end, right, compared to some of our other pelvic conditions, these numbers, right, take into account what's reported. So what patients are willing to report and discuss and kind of explore. And we know a lot of the time that symptoms are going unreported, as a lot of patients experience kind of chalk their experience up to just the norm and what they should be experiencing. But that just comes from a place of not understanding the true scope of it. So we're going to talk about the what and why of pelvic pain, and we're going to briefly touch on a few specific syndromes or diagnoses. And we're going to talk about the role of pelvic floor PT and what pelvic floor PT could look like for someone who is coming to Limitless. So the specific conditions that we'll break down, we have pelvic joint pain. So on this right-hand side with the skeletal image of the pelvis, we have started the pubic symphysis, as patients can experience pubalgia or pubic symphysis dysfunction, essentially pain or impairment around the region of the pubic bones and the articulation of those pubic bones in the front, as well as tailbone or coccyx pain. In regards to more somatic or muscular or tissue-based experiences, patients can experience vulvodynia, which is pain and dysfunction or symptoms along the external genitalia, referred to in females as the vulva. They can experience vaginismus, which is dysfunction and pain occurring along the pelvic floor muscles and the smooth muscles of the vagina. And then we can also have rectal pain, rectal spasm, typically involving the smooth muscle of the rectum and pelvic floor that is kind of traveling posteriorly to the coccyx and the sacrum that interacts with the rectum and works and coincides with our anal sphincters and anal tissue. So pelvic joint pain, we talked about or referenced pubalgia or pubic symphysis pain that's occurring in the anterior aspect of the pelvis. This is a specific or unique joint that is highly indicated in our pregnancy and postpartum population of women, as well as individuals who suffer kind of a traumatic fall or contusion type injury to the hips and to the pelvis. We often have patients coming in and expressing pain that's occurring very centrally in the front of the pubic region, made worse typically with walking, with going up and down stairs. And if they're involved in some strength and conditioning exercise, it may be more pronounced when they're doing more single leg biased exercises, such as lunging or stepping up, stepping down, things of that nature. This, again, is a really unique area in regards to the pelvic floor, as it's a primary attachment site for the anterior fibers of the pelvic floor muscles. So we can see some referred pain occur here from the pelvic floor, or see some sensitivity or some co-occurrence of bladder dysfunctions in relation to pubalgia or pubic symphysis pain and dysfunction. More posteriorly, right, is the coccyx, which is just that lower final piece of the sacrum. And this is a unique area, again, for the pelvic floor, as it's where the posterior fibers of the pelvic floor are attaching. And it is also an area that is implicated with traumatic falls or injury, and can be a significant component in an individual's bowel health. So this often coincides that if someone has coccyx related pain or just has some long-standing issues with their bowel movements, sometimes the coccyx can be kind of that secret contributor. The soft tissue conditions or other pain conditions that can occur, vulvodynia, right? This is involvement of the vulvar region or the external genitalia for females. And typically a patient will come in expressing symptoms of a burning pain, maybe a swelling or a fullness sensation, maybe an itchiness or a dryness sensation. And this is often symptomatic to the touch or to the stimulus. So some patients will experience it with there are different clothing they wear. Some will experience it with higher friction, such as bathing and cleaning. And some may experience it really just when in a sensual aspect or regard, when there is attempted sexual penetration or stimulus along the vulva. Sometimes also these symptoms can feel like they are unprovoked. So there's not necessarily a thing that happened to cause these symptoms to occur. And this really leaves patients kind of out in left field, questioning and wondering what they are experiencing and what is essentially, right, quote unquote, wrong with them. Some common causes and things that we would unpack in the eval for a patient with symptoms consistent with vulvodynia would be their hormone health and hormone state, especially in females relative to menses, relative to pregnancy, postpartum, and relative to perimenopause and menopause. Also, genetic factors. So, do they have family members who have a history or former experience of symptoms similar? We also want to know about history of infections or active inflammation, irritation, any trauma or physical abuse and trauma to the tissue or to the area, as well as some of their nutritional health, as some urinary irritants, right? Some of our waste that we void can be a tissue irritant. That's specifically referring to oxalates. And then we want to know if there are some chronic pain disorders, as those can be associated with the higher prevalence of vulvodynia. Vaginismus is referring to recurrent or persistent spasm, involuntary spasm of the outer third or more outer third of the vagina, which subsequently interferes with things like vaginal penetration, whether that is during sexual activity or gynecological exams, use of a tampon, really any stimulus that is taking place within that vaginal orifice. We can see women experience and we can measure increased muscle activity of the smooth muscle and of the pelvic floor muscle. Some contributors here would be the experience of pain or the anticipation of pain, the sense of fear or general anxiety, feelings of distress, as well as some other dermatological and musculoskeletal dysfunctions. Treatment is really multi-components. It is psychophysiological, as well as neuromuscular based dysfunction. So the evaluation process is really critical for these individuals to help identify some of these components that contribute to this syndrome, and then identify the best plan of care, the best course of action to address some of these different buckets based off how that patient is presenting. And then rectal spasm and pain. So this often goes hand in hand with vaginismus, but can occur individually and is often the experience for some of our males with pelvic pain, where they don't necessarily have the genital pain, though some do, often at like the base of the scrotum, or pain relative to voiding, or pain during sexual activity. What happens is a lot of these men are also experiencing rectal spasms or rectal pain as well. Contributors here can be active infection, so urinary infection, or in our males, prostatitis, but also dysfunction relative to their bowel health or one's bowel health. Uh, Secondary components of that coccydynia or coccyx pain we discussed, and then pelvic floor muscle dysfunction, where you can kind of get this ripple effect of muscular guarding and spasm that occurs across the pelvic floor muscles. And then again, there is that psychosomatic component, where since experiences of stress or anxiousness, sadness, uh, can all kind of um, contribute to this heightened nervous system state. And in that heightened nervous system state, we then see more muscular guarding. And in the pelvic floor, that can present as rectal spasm. And then a neurological case, and is a pudendal nerve dysfunction. And this is essentially nerve related pain, so sharp, shocking, shooting pain that can occur within the inguinal region, or more so within the vulvar region for our ladies, and then posterior to the scrotum, kind of perirectal for our male anatomy. Causes of this could be entrapment of the nerve. Sometimes that is acute entrapment due to acute inflammation and trauma. Sometimes it can be a pseudo entrapment from heightened muscular tone and tension. Sometimes it can be from a stretch or traction related injury, often related to trauma in males and in females due to pregnancy and labor and delivery. In across both, we can also, as far as entrapment and sometimes traction injury goes, we do see this in sport. So entrapment injuries, think of your cyclist or your individual who is sitting for long periods of time on those uniquely shaped seats. This in a long duration over a long course of time can cause entrapment and some of these symptoms to occur. And then different hip or pelvic related injuries in sport can sometimes also involve the pudendal nerve. So an individual experiencing pudendal nerve dysfunction could be reporting, or is likely reporting, sensitivity and pain with sitting, a burning, shooting sensation, stabbing sensation, or just distorted sensation. So some numbness within that perineal region. So the why and role of pelvic PT. So pain in any consideration, whether it is within the pelvis or within the shoulder or the hip, right? It has multiple components to it, right? That's something we just can't ignore. Is we can have very local tissue related contributors to pain, but then also this beautiful and robust nervous system that also contributes to an individual's pain experience. So when an individual presents to pelvic PT with a pain condition, we really have to do our work to kind of unpack those symptoms to get to some of those underlying contributors. So we want to assess the skeletal muscles and joints of the spine, the hips, and the core, the muscles of the pelvic floor itself, the smooth muscles of some of those organs, right, being the bladder, the vagina, the rectal tissue. get a sense for this person's nervous system states, their sympathetic state versus their parasympathetic state. Get an idea of if there is relevant tissue healing occurring and what the general tissue health is, what this individual's systemic health is and hormonal health is, and significant piece is their mood and emotional state. So can we talk about their stressors, their triggers for anxiety, how they're handling stress, and address some of their symptoms alone by talking about those and putting some action steps in place for those. So when a patient comes for a PT evaluation, we're going to do an orthopedic and a loading assessment. We're going to assess the bladder or the rectum, the vagina, and do a pelvic floor assessment using ultrasound as well as a hands-on manual digital exam. And then we're going to get very clear on what their lifestyle habits are as far as what they eat, what they drink, their stressors, their day-to-day choices, and their day-to-day work-life activities, and to, again, just get a very clear picture of the different components that could be contributing to their pain experience. And then as far as their experience in pelvic PT, it's highly based off of all those things we just discussed. We're going to try to optimize those lifestyle components to the best of our ability, or direct them towards an individual and a specialist who can help them do so to a much higher trained and skilled manner as needed. And we're going to address the relationships of some of these different joints, because a lot of times what's occurring in the spine can affect the pelvis, and what's occurring in the hips can affect the pelvis, and vice versa. So we want to have good balance across these different skeletal systems because they rely so much on each other. For pain conditions, we typically will incorporate down training progressions. This is with the intent of tapping into our parasympathetic nervous system, aiming for reducing muscle tone, muscle activity, muscle guarding, and improving the individual's mood and emotional state around some of these stimulus. So essentially desensitizing tissue to stimulus. So that will come in the form of direct hands-on manual therapy. It could come in the form of indirect pelvic floor work, such as diaphragmatic breath training, myofascial release work, joint mobility work, flexibility exercises, all things that we know can bring down tone and tension within the pelvis, within the muscular tissue of the hips and the core. And then, right, once symptoms have reached a state of not being bothersome to the patient, we then need to reload and reprogress this patient back for their ADLs, for their activities and exercise and stimuluses throughout the day, right? So PT does not stop at being symptom free. It stops at fully returning to all of those activities that they once enjoyed but could not do because of their symptoms. So sometimes that's physical movement and exercise. Sometimes that's sexual activity with a loved one or with a partner. It varies patient to patient. But I think what's important is that we are taking patients beyond just their immediate pelvic symptoms, and we are thinking broad scope, long term, how can I also improve this person's wellness and longevity? And again, that ties back to our mission here at Limitless of giving someone an opportunity to work towards their best possible health outcome and being a guide for them in that, being a guide with them in that journey and walking alongside them in that. So I appreciate your time in using and referencing this presentation. I hope it is helpful in just giving a little bit of a glimpse into pelvic health and specifically pelvic pain conditions. If there are questions that have gone unanswered or questions brought up that you didn't know you had before, please don't hesitate to reach out to us. We love connecting with medical providers as well as patients, as well as just other specialists within the realm of health and wellness. So again, thank you for your time, and I hope you find this very informative.